Hello everyone, this is Shadi Reis from CVI 2023. I'm really privileged to be with Dr. Ahmed Elborae. He's from Cairo to talk about a challenging case. Ahmed, thanks for being with us.
Thanks a lot for having me.
Yeah. So we share offline about challenging case in coronary that you presented here,
Yes.
about challenging of patient position.
Yes.
So walk us through the case, please.
So it is actually a 78-year-old female patient presenting with extensive anterior SC segment elevation myocardial infarction. This patient actually had a back problem, lumbar disc prolapse. She couldn't lie flat at all. So the patient can lie only in her right side. So it was a challenge to perform primary PCI on this novel position. I have opted for a left radial axis. And then I started with the classic right cranial view for the LAD. And I astonished that I got a left cranial one. And it takes some time to understand the new position and orientation of the different views, that the view shifted 90 degrees towards the left side.
Yes.
And hence everything went smooth after this.
Yeah. So it was a STEMI or was it?
Yes, STEMI, extensive anterior.
Anterior.
Yeah.
So LAD
was totally occluded in the proximal segment. So primary PCI was done by a couple of stents with team 3 flow, and the patient went smooth and discharged after
So
a couple
how
of
do you
days.
stabilize the patient on the table? I know it's challenging just to keep the patient stable so it doesn't move with the guide in.
Actually, the patient has her left leg slightly flexed. So this make this position slightly more stable than just keep it straight.
Yeah. And how about the right hand? What was she doing? It's next to her?
She
or?
was next to her, yes.
Okay.
And left above her side, just like this.
Okay. And so this way you got her axis.
Yes.
And then like you're going through a femoral, but the only issue is the views with the
Yes,
II.
shifted 90 degrees toward the left.
Left,
this is the key of understanding.
If you do AP crani, basically you
give
are
lateral.
LAO.
The AB give lateral, lateral give AB.
Yes, yeah.
And,
yeah, and it was easy engagement, or it was.
yes, thank God.
Yeah, at least that's right. So let's speak sometimes of the challenges. With that, did you notice or did you have any concern about radiation, or doesn't matter?
Actually, this came to my mind. This might be less radiation overall if the patient, for example, have an RCA lesion and we choose the lateral view to get more visualization of the mid segment. Yeah. In this position, we can get the lateral view from a neutral AB1 with less radiation. So we might get benefit from this novel position in such.
So sometimes it's inconvenient for the patient.
Yes, I come to my mind. There is a million of coronary intervention cases done since 70s. But we never asked the patient, are you comfortable while lying in this position flat?
Yes, we just assume.
Yes, it come to mind, what if we try to compare the patient experience in this novel position versus our standard spine position?
Yeah. Well, it's very interesting.
Yes.
Well, Ahmed, thanks so much for sharing this interesting case, and again, challenging that sometimes can happen.
Yes.
Watch these videos and others on the CVI YouTube channel. This is Shadi Reis from Austin, Texas. Thank you so much.
Thank you so much.